Precious. Good morning, friends. Welcome back to my channel. For today's video, we are going to do another code with me, but with a twist. We are going to see how many charts can I finish in 30 minutes. 30 minutes because I don't want to risk that my battery will turn off again. So let's just do 30 minutes. I will just finish this chart, and then after this chart that I'm doing right now, we'll start the countdown for 30 minutes. Okay. So again, this video will be unedited. This video also will be what do you call that? Will be realistic. It's the same as the other video that there will be no edits. There will be no yeah, it will be just like what you see is what you get, what I will do for 30 minutes. So let's start in a minute. I'm just trying to finish this one last chart, and after this we can move on to the next chart and then start the countdown for 30 minutes. So yeah, that's it. I'm down to one encounter for this chart and we can start. So thank you so much for liking my video and commenting, and then also like appreciate that I often upload videos now about medical coding content, and I will do more for the next weeks to come. And yes, we are done with this chart. We're ready to submit it. Okay, we have 30 minutes. Okay, it is 7:23 right now, and we will be done at 7:53. All right, let's start. This is the first chart. How many charts I can do in 30 minutes, and excuse me, how many charts can I finish in 30 minutes, and how long will it take me to finish a chart? For this one, we have a 30-pager chart. Okay, let's talk about this chart. Let's speak our mind about this chart. Let's see. So this patient has rheumatoid arthritis. It's taking medication. There's medication for rheumatoid arthritis, and it's also specified as rheumatoid arthritis involving multiple sites with positive rheumatoid factor. Okay, for us to find the correct code for that, let's type arthritis and then rheumatoid, and then with positive rheumatoid factor, that is 0 positive, and then specified, and then multiple sites. Okay, come on, my something is a little bit slow. Okay, here we go. Specified, and then it says multiple sites with positive rheumatoid factor, and it has without organ involvement. So the code for that is MO579. Rheumatoid arthritis with rheumatoid factor of multiple sites without organ or systems involvement, MO 5.79. Okay, let's look for more conditions. So this patient has only one condition, and that is MO 5.79. Let's move on. Although we are trying to figure out how many charts I can finish in 30 minutes. This chart is really small and there is only one encounter, but I make sure that the accuracy and the completeness of codes are there, and also the specificity of the codes. Okay, so in this chart, there's only one code. Let's submit that. Okay, that is one. Let's move on to the next chart. This is another small chart. There's a lot of fluff, and I believe there is only one encounter here. Okay, let's start. How did you like the previous video that I uploaded? Did you like that kind of video? Okay, here we go. So this patient has, let's see. Let's go to the impression. Okay, so the patient just have gynecological examination. There is nothing else. Then the assessment. Let's go to the physical exam if there is ulcer or artificial openings here. There is none. Medication. Okay, this patient just present for annual examination, and there is no diagnosis or there are no conditions present here. So that's it. That is our second chart. Let's move on to the next one. This is another small chart. I believe we will have one encounter here. Okay, what do we see here? So the patient has a hyperopia of both eyes. I believe this is an eye exam, an eye chart. I believe hyperopia does not, or hypermetropia does not risk adjust. Yes, it does not. Okay, let's look for more. Alright, so this patient, I don't see any reportable condition on this encounter, on this chart, so we can submit it. Okay, I guess that's chart number 3. Now let's go to our chart number 4. Still loading. Okay, this is another small chart. Okay, let's start. Okay, the patient is, let's see, has multiple bariatric surgery. In the assessment, there's nothing. The patient has ADHD, and I think, yes, ADHD does not risk adjust for this one, I believe. Let's try to code that one. Let's try to index that one. Disorder, attention deficit. Yeah, it does not risk adjust. Let's try again. Disorder, attention deficit, hyperactivity. Yes, it does not risk adjust. The patient has hyperlipidemia and anxiety. Those conditions in my current project right now does not risk adjust. Let's find more. Morbid obesity does not risk adjust. Okay, for this encounter, there are no conditions to be reported. Okay, let's move on to the next encounter. Okay, this is the second encounter of this chart. Okay, same patient, same conditions, and same. There are no reportable conditions for this encounter as well. Oh, there is mild protein calorie malnutrition. I believe that is reportable. Let's type malnutrition and then protein, calorie, and then it's mild. Mild is E44.1, and that is that risk adjust. So we can definitely call that one. And that is found in the assessment. What else? Okay, we have one code to be reported here. Let's read more. Okay, now that there is mild protein calorie malnutrition in the second encounter of this chart, I want to go back to the first encounter. Maybe I missed that protein calorie malnutrition. I just want to make sure that I report all the codes in this chart. Okay, so there is no protein calorie malnutrition on the first chart. It's only found on the second chart. Now let's go to another encounter with the same patient. Okay, in this chart, there are only two encounters. The first encounter does not have any conditions, and the second one has only one condition, which is the mild protein calorie malnutrition. The code is E44.1. Okay, let's submit that one. How many charts did I finish so far? Is it the number 5 or the number 4? Let's check. So, okay, I finished the 4th one. Let's move on. This is my 5th one now. So, the first 4 charts are relatively small charts. So let's see what are the next charts. Let's see what are the next charts. Are they small or large? Okay, this one is a 200 pager chart. And this is my fifth chart. Okay, let's make sure that the patients are matched. The patient's name is matched. And the date of birth. Okay. So this is a 200 pager chart. Let's see how many encounters are here. Let's start. 10 minutes have passed. Good job, guys. Thank you for watching. "20 minutes more to go." All right, let's do this one. The patient has GERD or reflux. That is non-reportable for my project right now. Okay, so I can see that the patient has abdominal pain and GERD. GERD does not risk adjust, so there is no code to be reported on this first encounter. Let's make sure. Okay. Let's move on to the next encounter. Second encounter, the same patient. The patient has bronchitis, cough, nasal congestion. Those conditions do not risk adjust. The patient has abdominal pain. And the patient has GERD. So no conditions to be reported. Let's move on to the next encounter. Same patient, same chart, different encounter. So the patient is obese, and that's it. There's no other conditions stated here. Overweight, GERD. Okay, no conditions to be reported. Let's move on to the next encounter. Okay, same patient, same chart, different encounter. Again, there is no codes to be reported on this one. Let's move on. There's a bit of a fluff here. There's a lot of fluff, I mean. Okay, we found another encounter here. Same patient, same chart, different encounter. Alright, there is no code. I don't see any code. Let's move on. I found another encounter here. This is the third encounter of this chart. Oh no, that is not acceptable. Let's move on. Okay, this is the sixth encounter of this chart. Same patient, same chart, different encounter. And yes, there are no codes to be reported here. This is the seventh one. Bronchitis, cough, nasal congestion, those are not reportable. And yes, there are no codes. And I believe this is the last encounter for this chart. Okay, there are no codes there. Okay, we are done with this large chart. So this is our fifth chart and we are on our 20 minutes. 10 more minutes, guys. This is the sixth chart. It feels like, it looks like it's big. Let's see. It's 100 pager. Okay, let's find out. Okay, this is our sixth chart. Let's start. Okay, the patient has breast cancer. Let's see if the breast cancer is still active. So there is lumpectomy. So there is lumpectomy. Let's see if there is an active treatment like a medication. I don't see a medication. So this the breast cancer might be eradicated and not treated now, and it might be gone. Okay, so in the assessment, the breast cancer has no evidence of disease, We also checked that there is eradication, there was lumpectomy, and there on the medication list there are no medication for breast cancer. So the breast cancer will not be reported. And does the patient has other condition? No. Okay, so for this chart on this first encounter, there are no codes to be reported. Let's move on to the next one. Okay, breast cancer again. Let's see if there is eradication and no active treatment. Okay, in the assessment, there is no evidence of disease. There was eradication, and the patient is not on active treatment or on medication. So we do not code breast cancer. Okay, let's go back and see if we can find other conditions for this patient. The patient has hypercholesteremia, and that is not reportable. Okay, let's find more. The patient has hypertension. We do not report that for this project. Okay, on that second encounter, there are no codes to be reported. Let's move on to the next encounter. Okay, we have our third one here. The same patient, breast cancer. Okay, the patient here has diabetes and breast cancer and hyperlipidemia. Okay, for the breast cancer, there was a lumpectomy, and the patient have undergone radiation and chemotherapy, and there is no active medication for the breast cancer. We do not code that, but there is diabetes, and the diabetes is being treated by a medication. Let's make sure that we are getting it right. Okay, we have diabetes for that one. Okay, we have 3 minutes left for our 30 minutes. Okay, the patient has cerebral meningioma in the assessment. And I guess you can report that. Yes. Just making sure we are not forgetting things. Okay. So the patient on this one has diabetes and cerebral meningioma, and the code for that is D32.0. We can save that. We have 2 minutes left. And let's move on to the next encounters. Oh. Okay, we are on the last encounter. Okay, breast cancer again. His status post chemotherapy and lumpectomy. No evidence of disease for breast cancer. And the patient has hemangioblastoma. Hemangioblastoma, neoplasm, connective tissue. Let's go back to it. Oopsie. Okay, guys, we made it to the 30 minutes, and I am actually on my last encounter for my 6th chart. And then let me just finish this chart first. So the patient has hemangioblastoma, but it is status post craniotomy, and there was already a removal of the hemangioblastoma. So let's see. The eradication is documented. Yes, is treatment documented? There is no treatment to the hemangioblastoma, so we do not code that one, but we do not code also the breast cancer. Okay, there is no code reportable on this one. I'm gonna go back to the previous encounter just to make sure that I did not miss the hemangioblastoma if there was. Yep, I did not miss that. It was not reported because it was uncertain. Okay. Okay, I am done with this last chart. So I exceeded a minute on that. So I think I would consider still a 30 minutes on that one. So we have finished 6 charts for 30 minutes. And yeah, we finished 6 charts in 30 minutes. And that is kind of fair because there are like 5 charts that are small and there are 2 charts that are large. So yes, we finished 6 charts for 30 minutes. Thank you guys for watching, and I will still continue working here and continue liking my videos, commenting, and yeah, thank you for watching. I will see you on my next one. Bye.